Welcome to the Medical Center Show. My name's Joe Scott, the President and CEO of Jersey City Medical Center. This week, we've got one of our premier OBGYN physicians, Dr. Ahmed Yousry. We'll be right back to talk about OBGYN.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back. We're here with Dr. Ahmed Yousry, one of our premier obstetrics and gynecology physicians. Dr. Yousry, tell us a little bit about yourself. You're here in the medical office building on the campus of Jersey City Medical Center. Tell us about your education and training.
Hi, Joe. How are you? Thanks for being here. I really appreciate being here today. My journey started with internal medicine in the old Jersey City Medical Center when I joined as a residency program.
So you were actually a resident up at the old medical center?
Yeah.
Wow. You don't look that old.
It was a great time and a great opportunity for learning. Mm-hmm. After joining the internal medicine and being oriented with all the premier medical attendings in the medical department, I was called to the consult once to the OBGYN department.
Okay.
And, I found my heart going there, and I was so satisfied with medicine and learning on medicine, but as soon as I saw the happiness of delivering a baby and the completeness of the OBGYN specialty, it caught my heart right away.
Oh, good.
I talked to my chairman, and I told him that I have a change of heart.
Okay.
And immediately he was very supportive, actually. And after 1 year,
so after 1 year of internal medicine, you went right into OB?
I switched in OB at Jersey City Medical Center. It gave me a very solid learning for internal medicine, but I found that OB had more to do, and I liked the surgical aspect and the medical aspect. And once you become an obstetric and gynecologist and a patient develop that kind of relationship with you, you start feeling the sort of caregiver. Right. And you start to answer all the questions.
Yeah, I know you have a big heart, because that's how you operate.
And it's an amazing experience.
Yes.
So we finished the residency, then I joined as a faculty in Hackensack University Medical Center.
Right.
And from the first month, I know the solid experience and learning that I got from Jersey City Medical Center. After a few years, I start private practice there. I have an overseas venture. Came back to Jersey City Medical Center in 2008, and since then it has been great.
Yeah.
Everybody's very supportive, warms like a home coming back.
So we're happy to have you there. You're one of our premier doctors on our campus, and we're thrilled that you're there.
Thank you so much.
So tell me about, let's talk about OB first, and then we'll talk a little bit about GYN. But OB, obviously, one of the most important things for someone who's considering getting pregnant is to start to talk to a physician who specializes in obstetrics. So what do you recommend? Let's just say a young couple decides, you know what, it's time for me to, for us to start having kids. Do they come to you first, or,
Absolutely.
Is it good to have a checkup before they start that process?
Sure. Preconception counseling has been one of the first visits and service that we should offer all our patients to screen them for any kind of diseases that can affect their pregnancy or the outcome of their pregnancy. And it's simple blood work and going over the history and the genetic history of both couples and the family history of any diseases that can affect the pregnancy. A lot of things that can be treated prior to conceivement is very crucial for the pregnancy. Some radiological testing are safer to be done prior to pregnancy than to be done after getting pregnant.
Right.
So we always encourage our patients and their husbands to come over and to start that preconception counseling. One of the few things that we also trying to implement is to start their healthy diet and any bad habits counseling. Smoking, alcohol, talk about exercise, talk about healthy eating in pregnancy and prior to pregnancy. Prenatal vitamins has played a crucial role. And I know you talked about anemia before in the previous segment, and the importance of the folic acid to be in the first 12 weeks of pregnancy.
So talk a little bit about that. So now we've got somebody who is pregnant, and some of the things that we need to do to make sure that they deliver a healthy baby. Folate's one of the key elements of delivering a healthy baby. Why is that important?
Folic acid, they found in the first 12 weeks of pregnancy to take 400 microgram of folic acid will prevent something called open neural tube defects. By more than 70 to 80%, because it helped the nerve cells to form well. And that's a devastating outcome that it's preventable nowadays. So we always encourage women to take their prenatal vitamin on a regular basis and to supplement any kind of deficiencies that you have. If they have a folic deficiency, iron deficiency, any other deficiencies are very important and crucial for the outcome of their pregnancy as well.
Now you talked a little bit about genetic testing and how important that is before people, even think about having a baby. So what are some of the tests that you perform on couples to make sure that that there's no issues there from a genetic standpoint?
Joe, every couple they want to have 100% beautiful baby with anything that can affect their baby. They want to know as early as possible. Genetic testing and testing for abnormal genes and chromosomes has come a long way. In the past, we used to depend on a blood work that used to give us only 60 to 65% assurance. And that went through a lot of changes, and it came to another ultrasound with blood work to be 84. We just developed or adopted at Jersey City Medical Center and in my practice a new test. This test for cell-free DNA in mom. And just a simple blood work that we drew from the mother that look for the baby's DNA and if the baby is a carrier of one of those chromosomes, namely usually trisomy, Down syndrome, 21, and another two others, chromosome abnormality, 18 and 13. Plus they can know the gender that early. And that test can tell us that. The sensitivity of that test is almost 99%. Since we adopted that test at Jersey City Medical Center and in our prenatal unit, we dropped the invasive procedure that we used to do in the past and could have led to miscarriages or complications or scared the mom to go through a procedure called amniocentesis, which is a needle that is introduced in the patient abdomen and aspirating the amniotic fluid from around the baby and test it. That blood work has replaced that a lot and give them that kind of assurance as early as possible so they can have a lot of options before bonding started and all the trauma that happens.
So the technology has really, really advanced when it comes to genetic testing. And so you're recommending that obviously someone's considering having a baby, they should see their gynecologist before even, or their OB/GYN before they even start thinking about having a baby. And then as you go through the process, make sure that you're following up with and getting good prenatal care. I think it sounds like that's key.
Absolutely.
To a healthy baby.
Very important to start the prenatal care early as possible, as early as 8 to 9 weeks. And to meet their physician and follow the recommendations so they can have a very nice, healthy prenatal care, pregnancy, and a beautiful outcome.
We'll be right back with Dr. Yousry.
Thanks.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line.